Lion feels that. Oh. Lion feels that in response to increasing numbers of plus size patients, nurses should do what? So that's what it is. I'll tell you how to analyze this question. You analyze first. So here we can categorize this question into three parts. We can group it into three parts. Okay, now let us see. How can we separate? There is a word called that. Okay, and there is a comma. Right. So this is breaking into three different parts. This is breaking it into three different parts. The first one is here. The first one is here. Lion feels. This is the first part. Right. The next one. In response to increasing numbers of plus size patients. Okay. So this is the second part of the sentence. And third part is nurses should do something. Nurses should. Nurses should. Okay. Yeah. Nurses should. Okay. Nurses should do something. So nurses should. Nurses should do something. Okay. Do something. Focus on that one. So do. Okay. Do. Nurses should do something. Okay. Do what? Take. Do means take. Do means be. Okay. Remain. Okay. Then what is this something? What is this something? What is this something? A lead. Okay. Proactive. So you should be proactive. Do something. Be proactive. Okay. Active. Remain focused. Okay. So nurses should take a lead. In what? In educating them about the risks. In educating them about the risks. So here the main part is, okay. Main part is education regarding risks. So risk management, we can say. Okay. So take a lead in educating them about risks. So risks are there, so we should provide education. So education is more important here. Education is more important here. They should be educated. Risks are already there, so you have to educate them. Means provide education, give them knowledge. Okay, give them knowledge. Now in the same way, try to identify in the second part. Try to identify in the second part which word do you think. Okay, think for 5 seconds, you'll get an idea. Okay, you'll get an idea. Right. Now what do you think? Come on, all of you, type your word. Identify. First one is education. Educating. Okay. So education is important. Then next one, second one. Two people have given the answer. One is investigating and one is problem. Okay. Come on, what do you think? Yeah, risk means problem. Same thing. Risk means problem. So there is no difference. What is the most important word here? Investigation. Investigating. So investigation, that means you have to do research. This is the most important word. So the nurse should research. Okay. She should do something. Okay. And in the first step, patient should get the knowledge is important. Second one is she should do something because she has knowledge. Okay. In the same way, right? Remain focused on providing them with the best possible service. Providing. Providing. Okay. Them with the best possible service. Providing best possible service. Service is important here. So here, service is important. Okay. First one is education is important. Second one is research is important. Third one is service is important. Providing service. Providing service. Service is important. Investigating problem. Problem is not important. Investigation is important. There is problem always. So investigation is important. Providing is not important. Providing service is important. Service is important and you have to provide. Okay. There is problem. Problem is not important. Investigation is important to solve the problem. Try to understand the way how its question is asking. So double line I gave you for that purpose. First one is you should provide education. Second one is you should do some research, conduct research. Third one is you should provide service, assistance, support, care. Try to understand that one. First one is just a knowledge should be given. Second one is you should do some research. Third one is you should provide service. That's it. First one, service is not important. Education is important. Second one is researchers. Okay. So first one is patient is important. So he should know about it. Second one is the researcher important. You should research. Third one is service is important. So first one, patient is important. Second one, nurse is important. Third one is service is important. Okay, patient is important, so you have to give information. So patient is important. Second one is, okay, there's a problem. Nobody can help. You only should do. You have to be proactive in investigating why it is happening like this. So that is you have to do. So investigation is important. Research is important. So if it is not if it is beyond your hands, you'll appoint some experts. Next one, providing. Providing what? Providing is not important. Providing service. Service should be provided. So lack of service. So service should be provided. Best service is not there. That's a problem. Okay. No best service. So now you have to provide them best service. So no service to yes service. Ordinary service to best possible service. You're changing. So ordinary service is a problem. Ordinary service is a risk. Try to understand that. Okay. So extraordinary service you have to give. So service is important. Remember that. So you have to focus on these particular areas. You have to be focusing on these particular areas. Okay. Now, Lianne feels that in response to increased number of plus size patients, nurses should do what? Should provide education to the patients that there will be some risks if they do not follow, or they should investigate what is the reason behind it. Can they investigate? Are they authorized to investigate, first of all? How can nurses investigate? The investigation is on the part of the doctor, right? So by default, this is eliminated. By default, B is eliminated because investigation is not the role of the nurses. Okay? Investigation is the role of the doctors. Okay? So why is he facing problem? How does a nurse know? Generally, she can say something, but she doesn't. She is not vested with the authority to diagnose a patient. Investigating means what? Examining, observing, assessing, evaluating, studying, researching. So whose responsibility is this? What lies behind the problem? Why is this person obese? Why is this plus size? How can you do? You have to go to the doctor, then doctor will send for tests, and the test results will come, and based on that one, your treatment plan will be there. So by default, B is ruled out. So 1 point eliminated. 1 point is eliminated there. Okay. Then next one. Take a lead in educating them about the risks. Educating them. Take a lead in educating them about the risks. Okay. Nurse is in the last part in the service. Already education is already given, right? Education is already given. Okay, what they should do, what they should not do, how they should manage the condition, what precautionary measures they should do. Okay. Nurse is giving education or assessment or a diagnosis or service. For this, do you think you need to go to the audio? Nurses should educate them about the risks. Nurses will educate them about the risks. Who is the authority to educate them about the risks? Okay, investigations. Okay. How can a nurse investigate what is the problem behind? So if that is the responsibility of the doctor, he will, if he cannot also, he will send for laboratory tests and then afterwards he will decide. Okay. Then remain focused on providing them with the best possible service. So nurses are meant to provide service, not to teach them, not to evaluate their condition. They cannot diagnose the patient. Okay. They cannot diagnose the patient. They cannot provide education. They can provide education only when the doctor says that the doctor is busy and yeah, It is the responsibility of the doctor, because doctor only can diagnose the condition. Doctors only can diagnose the condition. Okay, education. Okay, so after diagnosing, after evaluation only, you will know that there is a problem. Okay, you will find out a problem. See, they are related actually. B, first you are going to diagnose, investigate, evaluate, assess, research, okay, inquire from others. So you are investigating what is the problem behind. After finding out the problem, so that means there are some risks. No? There is a medical condition. So there are some risks. These risks, the patient doesn't know. So he should be educated, he should be informed, he should give given knowledge. So who is the right person to give the knowledge? Okay. Try to understand the point what I'm telling you. Second one, B is diagnosis stage. You are diagnosing. Who will diagnose? Doctors will diagnose. Doctors will diagnose in general. The next one is, after diagnosing, you know that this is a problem. So you will give precautions. Don't do this, do this, don't do this, avoid driving, avoid lifting things, take rest, do not get out of bed unnecessarily, walk for so all these things you are giving, that is educating. When? After a diagnosis. And who will do that? Okay. That is the responsibility of the doctor. Or the doctor will tell the nurse to explain. So then the nurse will explain. Okay. The next one, remain focused on providing them with the best of. So, what is the role of the nurse actually? Is it education? Provide education. So that education you will provide when the doctors tell. When the doctors don't have time, then when they tell you go and explain them, then you will explain, because doctor has already told the condition. So for that, what procedure you have to follow? The doctor is the best person to give. And secondly, investigations. Who will give assessment, evaluation, observation, study, research, laboratory test, and all these things? Okay. So education will be given. And then the mental knowledge, okay, practical solution, everything will doctor will give. Then afterwards, the patient will be given the responsibility. The patient's responsibility will be transferred to the nurses. Then what type of care should be given, what type of assistance should be given, what type of support should be given, what is the service that is to be given, that is it. Follow-up action plan, ongoing care, appropriate management. Okay, all this part of service. This is the last stage. No? First is B, that is diagnosis stage. Second and we do's and don'ts, suggestions, precautions and everything, information stage. And third one is the main service there. Okay, just service. So that means, let me tell you one thing. I'm converting this into a style now, a technique now. Now, is there a doctor? Let me call a doctor. Kaval is there, I think. Kaval, unmute.
Yes, sir.
Yeah. Now I'm asking you, are you able to understand what I'm saying? You're a doctor, right? And nurses
Yes.
also know what I'm telling, everyone knows. Doctors know,
Yes.
nurses know. So,
Mm.
education, who is the authority want to educate him?
Education by doctor,
Doctor only.
investigation
If
by
doctor
doctor,
is not there, a
then nurse. Yeah.
senior nurse will give, because doctors know that the nurse knows the knowledge, then only they will give. Otherwise, they will not tell them, right?
Yes. Yes.
So an experienced nurse will give, not an any nurse will not give. Experienced nurse. If doctor
Yes.
is busy, doctor will give the responsibility to some senior nurse who knows everything. Education, it's the doctor's duty actually, but the doctor is busy, then that's it. So which one happens first, B or A or C?
First, by Doctor A. And then D, and nurses usually do the services,
Yeah,
I think.
right.
Yeah.
First one is you will diagnose a problem, right?
Yeah.
You will diagnose a problem. That means what is the reason behind it? You will diagnose. For example, I have type 2 diabetes. So I did the investigation and I diagnosed the problem. Is that clear?
Yes.
Then after diagnosing the problem, there is a problem, diabetes mellitus. There are risks, yes or no?
Yes, obviously.
So we have to avoid the risks, right?
Yeah.
So you will tell the patient, right?
Yes.
That is called education. Now you understand? So you are educating the patient. So this will be done after investigating. Immediately the doctor will tell to the patient. Okay. Then afterwards, after giving everything, then he'll tell, give care for this patient, take care of this patient. That's all. So what injection should be given, what treatment should be given, what monitoring should be done. All these things the doctor will tell, and the nurse will go on doing the providing the service. Nurse will provide the service. Right. So you can understand very clearly. So take a lead. Lead for what? Verb is not important. Noun is important. Educating. Educating is also a verb now. So change it to education. So education should be provided about the condition and the problems of core pros and cons. That is A. Second one, B. Investigating what lies behind the. So investigating means what? So you investigate means you go for some tests, physical examination, and what all tests you do. Then afterwards you send the to the laboratory and you will get the report. That report, okay. So you're investigating what is the problem by taking the X-ray or something else. You're investigating what is behind that particular problem. Next one. So there is a problem. Okay, that is part B. Text B. There is a problem. So what is the reason behind this? There is something which is the reason behind this. So you are investigating. Okay, you are investigating. Means you are researching, you are studying, you are observing, you are finding out, you are discovering. Right. The next one. So what you are going to do? You are going once the results come immediately, you will tell them. No, that is education about the condition, about the risks, about the problems which they may face in the future. After diagnosis only, you can tell now what type of risk associated with type 2 diabetes mellitus. So first you have to diagnose that the problem. There's a problem, diabetes mellitus. Already I have diabetes mellitus. That's a problem. I don't know. You don't know. Nobody knows. So I came to you and said, Doctor, this is my problem. I don't know what to do. Oh, your problem is this. Okay. Your problem is this. So that is, okay, investigation. You are diagnosing a patient's condition. The next one, right? So these risks gave potential problems. So these problems, what are the problems that he will face? Who will tell? Doctor only will tell. Then and there, once the result is there, immediately you have type 2 diabetes mellitus. Okay. So now from now onwards, you have to take care of this one. What? These risks. So you have to avoid these risks. There is a problem. I already investigated, and now I came to know what are the risks because of this problem. So I'm educating you. I'm providing you all the information. You have to stay indoors, or you should not go out. So all these things you will inform. Then after education, then you will pass on the responsibility to the nurse. A nurse will give the service, ongoing care, follow-up action, dressing changes, okay, medication monitoring, observation, everything is service. Okay. Everything is service here. So now you can understand the secret behind what I'm telling you. So do something. What is that something? Why? That's, let us see here now. Yeah. Yeah. Do is a verb. Means take. Do means be. Do means see, remain. See is remain. So we got all these three things now. Everywhere do is there. Do means take. Take what? A lead. Lead for what? To avoid risks. So what should you do? You should educate the patients. You should train the patients. You should give information. You should give knowledge. Okay. You should discuss about everything. So that is education. Pass on information orally. That is education. The next one, after giving education, doctor will not be always with them to take care of that one. So the service part will be taken by the most important part, diagnosis, will be done by the doctor. Okay. So now I'm going to play the audio. Yeah.
Occupational English test. Different types of cholesterol to measure not just the total situation. It doesn't touch the gene itself, an idea about which special interest in the care
Be attentive. Education or investigation or service.
Today I'm talking to Lianne Haydock, a nurse with a special interest in the care of obese or plus-size patients. This is a real issue, isn't it, Lianne?
It is. The number of people carrying extra weight's been on the increase for some time. Obesity now affects around 1 in 4 adults in many Western countries, and it's known to be associated with increased risk of health conditions including type 2 diabetes, heart disease and stroke. But we shouldn't forget that the reasons for this increase are complex and often very challenging to understand. So addressing the root causes of the issue isn't the job of health professionals on the front line. Our job is to offer optimal care for these patients. And this means moving away from treating them as the exception to the rule, towards making them an integral part of what we do. I'm committed to that idea, but making it happen is easier said than done. It means a major shift in both attitudes and policies.
So what sort of attitudes towards plus-size patients have you come across?
One issue they face.
Yeah. So 7, 6, 5, 4, 3, 2, 1. Submit your answer. Yeah. Right. Now we'll learn about the signposting now. So let us check our answer. Yeah. The right answer is question number 37. Question number 37. What is the answer? Yeah. This is the answer. Yes. Now let us see how to identify this. Lot of information is spoken. Lot of information is spoken. How are we going to reduce this now? Yeah. Yes. So this is what you have to learn now. Okay. So here it is. This is the first question. Yeah. Yeah. Now go through this. I have converted this listening into reading. Now check it out. They will talk about all the three. Just study. Yeah. No, these are techniques both for reading and listening. It is the same technique. Yeah. So, all right. Now let us see the options what we have discussed. Education. Second one is investigation. And third one is service. These are the three words. So these are nouns. Educating, education. Investigating, investigation. And service, service. Now, notice where these words are exactly. Where these words are exactly, that you have to notice. Okay. Now, Lianne feels. Lianne is the second part. Okay. What Lianne is talking is this female. This is the one. Okay. So you are going to focus on this particular thing only. Okay. This is the area which you are going to focus. Now in this, these three words will be there. They will be there. Now let us see. Identify those words. Because you are learning the secrets now. Identify those words. Yeah, Precious, be there. Whether it is reading or listening, be there. Okay. I already sent in the group listening, part C. Huh? Okay. Now check the words. Now here, now, but wherever but is there, it's very important. But we means nurses. We means nurses. Okay. Now, there are some challenges. We shouldn't forget that the reasons for this increased are complex reasons. Okay. So, problem is telling about the problem here. Okay. Shouldn't forget that the reasons for this increase are complex reasons, and are often very challenging to understand. They're often very challenging to understand. Often they're complex, means not simple. They're not simple, and you cannot investigate that easily. Often very challenging to understand. Even if you try, they're very challenging and it is very difficult for you to understand. So that is what he's talking about, investigating. So is another word, remember. But so like this, you're so addressing the root causes of the issue. Issue means problem. So if you see very carefully how I am eliminating this particular option, is very clearly he told everything. So this issue means the problem. Addressing the root causes. Okay. Addressing the root causes. Cause means reason. Root causes. Root is behind, under. So that lies behind the problem. The root cause, the reason behind this problem. It's very difficult to understand. So don't go for investigation. So isn't the job of the healthcare professionals on the front line, okay, the people who are directly dealing with the patients, okay, the people, it's not only nurse, it is about everyone, frontline office professionals. It is not. What is not? It isn't. Isn't means it is not. This is very important word. Let me give it in bold. It isn't. It isn't means not. So you can see, this is not the job of the health professionals on the front line. Who are front line? The nurses and doctors who are treating the patients face to face. Okay. So if this is not, then our job means whose job? Nurse's job, because she is a nurse. She is a nurse. Our job is to offer optimal care. Optimal care. Offer optimal care. So here is this answer. Okay, our job, our duty is to means should. Our responsibility, that means should. Okay, our job, nurse's job is to offer optimal care for these patients. For these patients, these obese patients. Try to understand. Now, that's finished. That is finished. Okay. Now, I'm giving you the other connections. Apply the same technique to everything. Okay. Now, first one. Yeah, patients, them. Plus side patients, them. Yeah, you can see that there. Patients means them means patients. Okay. Now, next. Okay, these patients. Which patients? These patients. These patients means plus size patients. These patients means obese patients, plus size patients. The second word. Okay. Then care. Care means a service. Okay, care means service. Optimal. Optimal. Okay. That means best. Optimal means highest level. Okay. You should know the meaning of that one. Offer means provide. Our job, that means our focus. Our focus. Okay, our job is to means to remain, to be, remain. Try to understand the points which I am telling you. Our job. Whose job? Our means nurse's job. So our means nurse's job. Okay, means focus. Is to means remain. Okay, Offer means provide. Care means service. Okay. These patients, these sick plus size. Patients plus size means obese. So try to understand how he is very giving very clearly. Okay. So your answer, every word is a synonym. Remember that. Now, yeah, optimal is an adjective. Optimum. Yeah. Now let us see. Optimal is equal to optimal. It's a synonymous word. It's a word form. I'll take you to Cambridge Dictionary now. Yeah. Cambridge Dictionary. Optimal. Yeah. Optimal, optimality, optimally, optimum, all are related words. Optimal means what? The best, most likely to being success or advantageous, beneficial, best. Okay. The best possible. So optimum, the same word. Yeah. Optimum, same thing, best, most likely to bring success or advantage. Optimum, optimal, also optimal, same, two different words, same adjective. Optimum benefit or optimal benefit. Okay. Optimum benefit or optimal benefit. It has two styles. You can say that or you can say this. Means the best possible. So what is the synonym? What is the level of this word? Let us see here. Did not give. Okay, fine. No worries. Optimal. Adjective. Synonym. Optimum. Same thing. So I hope you understand the points which I have explained you now very clearly. So the synonyms will be spoken. Nurses, our job, focus, responsibility. Okay. Our work, our focus, our attention, our concentration. Is to be means remain. Is to be means remain. Optimal, best. Care, service. These, plus size, plus size. Patience, patience. Other than the word patience, nothing is same. So be very careful in identifying the words and their synonyms. Should be ready for that one. And also be ready for not and without not. Okay. So indiscreet. Yeah. Question 37. Okay. Explanation. Yeah, I have given you one way. There are many other ways to find out the answer. This is the easiest way I have explained. Okay. Right. So, same like that, you have to understand. Is the information clear? Yeah, if you feel that the information is clear, everything is understood, then you can message me yes. Otherwise, you can type your doubt or any question answer session now. Yeah, question answer session. What about others? It's not clear for you? Hmm? Just one word, you cannot type yes or no, or if you have any doubts. Huh? I'm trying to give you so much explanation so that you can understand, and you don't even have the generosity to tell, yes, sir, we understood. How do I know that you are going to understand it or not? Minimum, na? Somebody has explained for almost half an hour to explain you the best possible option. Huh? One word, one word. Be generous, okay? Be generous. How much generous I am trying to be for you. This evening time, will anybody will teach you, first of all? They want to enjoy their lives. I am sacrificing everything and I am sitting with you, trying to explain you. Huh? Okay. Anyhow, thank you. So, this is how you have to identify. Now, next. A second question. Question number 38. So this is question number 38. Okay. Yeah. This is the second question. Go through this question once. Yeah. Yeah, go through this one. What attitude towards plus size patients does Lianne find unacceptable? Okay, now let us see. I will call, whom should I call? Yeah, Keval. Keval. Dr. Keval, you can unmute. Hello? Hello, Dr. Keval. Can you hear me?
Yeah, hello. Yes, sir.
Yeah, something wrong with your mic, I think. Yeah, okay. Now, what attitude towards plus size patients does Liane find unacceptable? So, in these, there are two words which are very, very, very important. Can you identify those two words?
Attitude and unacceptable.
Very good. Unacceptable attitude. That's it. You have to identify like this. Very good. If you are going to target like this, you will get okay 42 out of 42. Definitely. I'm not exaggerating. There are students who got, I told you already, 9 out of 9 bands in IELTS. Okay. 460 also they got in OET. But nobody gave me 500. Let me see if anybody can give 500. Yeah. So here, the words that are more important are what attitude towards plus size. So if you see this, we are eliminating the unnecessary words. We are eliminating the unnecessary words. Okay. Plus size, we already know. We already know patients also. We already know Liane also. Lion. Okay. So if you avoid these words, now the most important words are these two. The most important words are these two. What are they? Unacceptable and attitude. Yeah. Unacceptable. First word is an adjective. And attitude. So, unacceptable attitude. What is unacceptable attitude? That's the meaning. So, what is, so attitude is there, unacceptable is there. This what we don't know. We have to find out what is the right answer. Yeah. So, what attitude towards plus size patients does Liane find unacceptable? So, unacceptable attitude. So, attitude is a noun. What attitude? Some attitude. What is that something? A belief. A belief that they are somehow to blame for their weight. It's a blame. So a belief that they are somehow to blame for their weight. They find that this overweight is a blame. So they blame their it is their, they think that it is their mistake. So they blame, self-blame. Self-blame. They think that it is my mistake. They think it is my mistake. They believe that they are somehow to blame for their weight. They are the reason for their weight. It is because of them. So self-blame. Self-blame. Okay. They are blaming themselves. They are to be blamed. So they self-blame. They are to blame. Not somebody else. They are to blame. That means they are blaming themselves. Why are you fat like this? It is my mistake only. When I was child, I ate more. That's why I am like this. Something, they'll say. Okay. So blame, the most important word. Yeah, Keval. Now in the second question, what is the most important word? Yeah, unmute.
Yes, sir. In the B option, lack
One word only.
yes, sir. Medical reasons.
Okay.
Lack of interest.
So lack of interest. What for what? Medical reasons. Okay. Lack of interest for medical reasons.
Yes, sir.
So we can say medical, right? So medical reasons, they don't believe, disbelief. They don't have interest. That is because of disbelief. We can term this as disbelief, lack of faith, lack of interest, lack of trust. Okay. Lack of guarantee, lack of surety. Okay. Lack of conformity, anything. There are medical reasons. You are not only the reason, medical reasons are also there, and they're not interested to think about this. They don't want to know about the medical reasons. My problem only. I only did something, that's why I became like this. They'll say it is my karma or something. A tendency to assume they have been trying to lose weight. A tendency to assume they have been trying to lose weight. This is called virtual belief. Virtual feeling. Assume is not reality. Assumption. Assume means not fact. It's fiction. You have to know the word assume. Assume means what? Assumption, presumption, guess. So they're guesswork. So the presumption is the problem. Assuming is the problem. Okay, they guess that. It's not a belief. It's a guess. Okay, probably I'm losing weight. No problem. I'm losing weight. I think I'm losing weight. There's a chance that I can lose weight. A tendency to assume they have been trying to lose weight. They believe that they are trying to lose weight. Okay. But will they really lose weight because of that? Or is that just, some blind faith, blind belief? So, what is this attitude? Self blame is one attitude. The next one is so they are reluctant to accept the fact that medical reasons are also there for their weight. Reluctance, not ready to listen. First one is self blame, second one is reluctance. One word. If the word is not there, you have to coin your own word. A is self blame, self pity. Okay, hurting oneself. Nobody is the problem. I am only the problem. I might have done something. It is because of me only I got this obesity. I became plus size patient because of me only. Nobody else is the reason. That is one. That is self blame. And B is lack of interest. Okay. Lack of interest. Reluctance. He's not interested. That means he will not follow your words. He is reluctant because he has no interest in the medical reasons for their weight. Okay. They are reluctant and they have closed their doors to knowledge. That is number 2. Number 3, tendency to assume they have been trying to, we are losing, I'm trying to lose weight, I'm trying. But can you really lose weight? Very difficult. Almost impossible. Because of various reasons. Okay. So a tendency, their personal tendency to assume assumptions, virtual feelings, virtual reality. It's not reality, it's virtual. It's faulty assumptions, guesswork. They're just guessing. Oh, I'm losing now. I'm losing. I think I'm losing. I'm trying to lose weight. I'm trying to lose weight. What? You go for a walk half an hour. You eat less fatty food. You do something. And you think that because I'm trying to do all these things. I'm doing all these things. What? Walking for half an hour. Okay. So they believe that they are trying to lose weight. But if they do like this, are they going to really lose weight? Not necessarily. Okay. Not necessary. So now I'll play the audio. You can answer the question. We'll start a little previous question, ending. Yeah.
Special interest in the care of obese or plus size.
Yeah.
Today I'm talking to Lianne Haydock, a nurse with a special interest in the care of obese or plus size patients. This is a real issue, isn't it, Lianne?
It is. The number of people carrying extra weight's been on the increase for some time. Obesity now affects around 1 in 4 adults in many Western countries, and it's known to be associated with increased risk of health conditions including type 2 diabetes, heart disease and stroke. But we shouldn't forget that the reasons for this increase are complex and often very challenging to understand. So addressing the root causes of the issue isn't the job of health professionals on the front line. Our job is to offer optimal care for these patients. And this means moving away from treating them as the exception to the rule, towards making them an integral part of what we do. I'm committed to that idea, but making it happen is easier said than done. It means a major shift in both attitudes and policies.
So what sort of attitudes towards plus size patients have you come across?
One issue they face is the very common misconception that they're somehow responsible for their size, that it's simply a lifestyle choice. Even amongst health professionals, you'll get comments like, if they just lose weight, there wouldn't be an issue. This is so unfair because the reasons for obesity are enormously varied and complex, and I find comments like this very disheartening. I can understand that it's human nature to judge other people, to wonder why someone's become so overweight, to feel that it was somehow avoidable, but none of that justifies offering this patient group anything but the best possible standards of care, and that's what we should be aiming for.
But treating them must involve adopting a different approach sometimes.
Yes, but we need to focus on finding the best flexible approach that works for all patients. Get away from the idea that the...
Yeah. Submit your answer, please. Yeah. The correct answer is A. You're right. So 38 is equal to A. 38. Yeah, that's it. Now let us study this one. Yeah, I'm converting this into reading now. So this is the second question. Yeah. Now go through this question. Go through this question. Yeah. Yeah. The answer is very clear here. So blame, self blame. Second one is lack of interest. Means what? Reluctance. He's not interested to do because he's not interested. That's all. Lack of interest. No interest. Lack of interest. No interest in the medical reasons. Okay. So medical reasons, lack of interest in the medical reasons. Okay, next one. A tendency to assume that they are trying to, this assumption. Okay. So now if you see the same thing here, what attitude towards plus size patients does Lianne find unacceptable? Okay, attitudes. So one issue they face is very common misconception. Misconception means wrong belief. This is a common one. Common means regular, usual, normal. Common belief, wrong belief. Misconception means wrong belief. Conception means belief. Mis means wrong. Yeah. The next. So, misconception, wrong conception. Now, I'm connecting the words. Okay. Conception, belief. Conception, it is belief. Conception means belief. Okay. That they are somehow, this is the very easiest, this is the easiest question or very easy question. Okay. That they are somehow to blame because they are responsible. Okay. Okay. Responsible. So they are somehow responsible. They are blaming themselves. They are blaming themselves for their size. Word to word. Okay. I believe that they are somehow to blame for their weight. They are only responsible for the weight. That's it. You can see everything is given word by word, line by line, letter by letter. Everything is there. Okay. So that is A. Okay. Yeah. This is question number 38. So you have to analyze. Okay. Okay. That it's simply a lifestyle choice. That's it. It's because of me it happened. Yeah. So we have gone through 2 questions. Thank you for patiently attending. So apply these techniques. Okay. How to find out word by word, letter by letter. If you find, check and confirm. That's all. So question 38. Question number 38. The explanation. Yeah, that's it. I hope you have understood how every word should be matched. Very easy. If you practice like this regularly, you'll definitely improve fast. So, right, what are your scores out of 2? Yeah. What are your scores out of 2? You can submit your scores, please. Yeah. Yeah. Bertha, Kaval, Keval, Kiran, Mustaba, Precious, Ram, Rani, all these are regular students. Okay. So, how to confirm? Now, coming to the sign posting. Okay. Sign posting. Sign posting, what is telling here? What attitude towards plus size? Attitude or unacceptable? So, this question is based on attitudes. When you hear the word attitude, automatically you should be ready. Okay. Because you are going to get the answer immediately. We will not wait for you. Right. Yeah. So, write your feedback 30 seconds. Yeah, Sandeep, tell me. You have something to ask? Tell me. Yeah. Sandeep. Yeah. Yes, Sandeep. Yeah, I will let you know. I'll let you know. Don't worry. Yeah. So, this is the way how you have to analyze the questions. So, that's it. So, prepare well and take one test and complete the test. All of you. See you again.